All right, hello everybody. 7 o'clock, so I'm going to go ahead and get started because we've got a kind of lot to go over today. I spent the last 3 days kind of talking about the Spanish flu, and this is a comparative course to, of course, what's going on today in the world with the coronavirus. And so I want to spend some time today talking about the coronavirus and the timeline of it. Modern history is very tricky, especially the history of things that are happening right now, because there's no time for analysis. There's no time to go back. There's plenty of time to go back and look at the Spanish flu from 100 years ago. But with things going on today, that's the problem. They're happening today and right now. And there's no time to analyze because they're happening. So mind you, as I go through this, it really is just a timeline, and it's only up to today because things can change tomorrow. But it's our best information, what we have, without any analysis. And of course, that leaves a lot of room for bias, especially from the media sources that you're getting it from. So keep that in mind as we go through today and kind of look at the coronavirus and what's going on with it. So what is the coronavirus? Well, coronaviruses are a group of related viruses that cause diseases in mammals and birds. In humans, coronaviruses cause respiratory tract infections that can be mild, such as some cases of the common cold, among other possible causes, predominantly rhinoviruses, if you've ever heard of those, RSV, and others that, such as SARS, severe acute respiratory syndrome, MERS, Middle East respiratory syndrome, that have been declared kind of pandemics in the recent past. Symptoms in other species that can contract these kinds of viruses vary. In chickens, they cause an upper respiratory tract disease, whereas in pigs, they can cause diarrhea. There are yet to be vaccines or antiviral drugs to prevent or treat human coronavirus infections. Of course, that doesn't mean that won't change. There's several promising things out there that are being worked on. The most recent common ancestor of all coronaviruses has been estimated to have existed as long as, I don't know, 8,000 BC. Though some models place the most recent common ancestor, MRCA, as far back as 55 million years or more, implying a long time for coevolution with bats. And we'll get into where bats fit in this very shortly, because I'm sure you've heard about the Chinese eating raw bat. That's what caused this disease. It appears that bats and birds, as warm-blooded flying vertebrates, are ideal hosts for the coronavirus gene source to fuel coronavirus evolution and dissemination. So it tends to live in them and mutate and eventually be able to cross over into other species. The most recent novel coronavirus, COVID-19, that we're certainly affected by right now, has a 96% similarity to a bat coronavirus, so it is widely suspected to originate from bats as well. The following is a timeline of what we know about the current COVID-19 coronavirus pandemic. It was first identified December 31st, 2019, when Chinese officials informed the World Health Organization about a cluster of 41 patients with the mysterious pneumonia. Most were connected to a place in Hunan, China, and a Hunan seafood wholesale market, which is a wet market. And the difference between a wet market and a dry market: a wet market sells live food, whereas a dry market sells staples like flour and things like that. So a seafood market would be considered a wet market. And this is located in the city of Wuhan in China, which, if you look at the map on the left here, Wuhan is very centrally located here. You'll see Beijing has the star on it right up top near the Korean Peninsula, just to the left of the Korean Peninsula. And Wuhan is about straight down from it there. And this is a map actually of the high-speed rail network. And you can see Wuhan's very central in this network. And so the disease very easily could spread outside of there. What you see with the picture on the right is merely a picture from the Wuhan wet market before all this took place, obviously, because if you Google and look at pictures of it today, everybody's wearing a mask there now. So though the first 41 cases were reported December 31st, scientists decided or determined that the virus could have begun spreading from person to person as early as late November. Case studies of how the virus has spread has showed that the large gathering of people at these live events, these markets, may have boosted the transmission of the virus among more people, researchers said. And given that they found how many cases they found in December, they could trace back that's probably late November that it's actually started spreading. And researchers think the new coronavirus did originate in bats and then jump to an intermediary species, either a pangolins, pigs, or civets, that then passed it on to people. Now, it can be spread among humans via respiratory droplets within 6 feet. And I'm sure you've heard that. You might have even already been to the store where they're putting those nice little blue rectangles out that are approximately 6 feet distant from each other. Please wait here for the next person. The viruses can also survive on many surfaces as well. And there's no clear evidence that the virus was transmitted to humans through the consumption of bats. However, bat soup is considered a delicacy. Bat soup is something that was served in the marketplace. But as far as the eating of raw bats because of poverty, there's no evidence of that as of yet. Could it have happened? Sure, but the evidence doesn't really point to that. On January 1st, 2020, Chinese authorities closed the Huanan seafood wholesale market. Wuhan authorities banned the trade of live animals at all wet markets soon after the first cases. China also announced a temporary national ban on the buying, selling, and transportation of wild animals in markets, restaurants, and online marketplaces across the country, a ban that was later made permanent. Farms that breed and transport wildlife to wet markets were also quarantined and shut down. January 7th, Chinese authorities identified the virus that caused the pneumonia-like illness as a new form of the coronavirus, and so novel, the novel coronavirus, or NCOV. And on January 11th, China recorded its first death linked to the novel coronavirus. January 13th, the first coronavirus case outside of China was reported in Thailand. A 61-year-old female tourist in Thailand was diagnosed on January 13th. She had recently spent time in Hunan, China. Airports in Hong Kong, Singapore, Thailand, and South Korea also began to closely screen passengers. By January 20th, the first United States cases reported. It was a 35-year-old man in Snohomish County, Washington. He had been evacuated from Wuhan, China, where he had been teaching English, and landed back at the Seattle-Tacoma International Airport on January 15th. And though he initially showed no symptoms, he reported to an urgent care clinic with symptoms of pneumonia on January 19th, and he was diagnosed with the virus a day later. By January 23rd, Chinese authorities placed the 11 million person city of Wuhan under quarantine, and the entire Hubei province days later under the same quarantine. And think of a province like a state. It's a pretty good sized state. So though Wuhan has a population of 11 million residents, population estimates for the surrounding countryside placed the full lockdown at 60 million residents. And this made China's action the largest quarantine in history. By January 30th, the WHO, the World Health Organization, which is an independent agency of the United Nations, told people of the health emergency of international concern. And the WHO's determination of a global public health emergency has been around since 2005 and has actually been used 5 times before. And those 5 include the Ebola outbreak that started in 2013 in West Africa, another one in the Democratic Republic of Congo that's been ongoing since 2018, the 2016 Zika epidemic, polio emerging in war zones in 2014, and the swine flu pandemic in 2009. By January 31st, President Trump banned foreign nationals from entering the U.S. if they had been in China within 2 weeks prior. February 2nd, the first COVID-19 related death outside of China was recorded in the Philippines. By February 7th, Chinese doctors and the novel coronavirus whistleblower, the one who had first stated outside of the Chinese government that this existed, a guy named Li Wenlang, died. At the onset of the outbreak, he was based in Wuhan, and he warned some of his contacts from medical school that they had discovered a virus. But he was reprimanded by the authorities and forced to sign a letter acknowledging that he had made false comments. This is what the Chinese government made him do. So Wuhan-based Li died a month after he sent out the warning message to other doctors and described patients with worrisome pneumonia-like symptoms at the hospital he worked at. And again, the Wuhan police had forced him to sign the letter saying he was making false comments. And you can imagine why. I mean, who wants to be thought of as, the home of this deadly disease, that you're the cause of it? So Li caught the coronavirus himself after treating people who had it. And Wuhan Central Hospital said at about 4 a.m. local time on February 6th, he died after all the treatments they provided to him were ineffective. He left behind a son and pregnant wife. After Li's death, Chinese social media was filled with outpourings of grief and anger. Many posts featured a hashtag saying, "We want freedom of speech." By February 8th, a U.S. citizen died in Wuhan from COVID-19. He was the first from the United States. This citizen was 60 years old, according to the United States Embassy in Beijing, but we really don't know little else about him. By February 9th, the death toll in China surpassed that of the 2002-2003 severe acute respiratory syndrome, or SARS epidemic, which killed about 774 people globally. Both SARS and the new coronavirus come from the same family of viruses, and they share about 80% of the same genetic code. SARS emerged in Guangdong, China, and affected 8,098 people globally over the course of 8 months from 2002 to 2003, and killed 774 people. Just a month after the first confirmed case of the novel coronavirus, the total global case count surpassed that of SARS. On February 9th, the death toll from COVID-19 in China alone exceeded the total number of people killed worldwide by SARS. The new coronavirus killed nearly 3 times as many people in 8 weeks than SARS did in that many months. By February 11th, the WHO announced that the disease caused by the new coronavirus would be called COVID-19. The Director General of WHO said we had to find a name that did not refer to a geographical location, an animal, an individual, or people. And he wanted a name that was pronounceable and related to the disease, and so that's how it gets the COVID-19 designation. By February 12th, coronavirus cases started to spike in South Korea. As China's number of new cases began to stabilize, South Korea's began to soar. And you can kind of see on the map, before I showed you the railroads and I showed you where Beijing was, right across from them is the Korean Peninsula. So it's not a big stretch of the imagination to think someone from China brought it with them into Korea. But we don't know exactly who that person was or where they were. The Korean CDC, Centers for Disease Control, believed that a 61-year-old female member of the Shincheonji Church of Jesus, known as Patient 31, triggered a super spreader event at the church's Daegyeol branch. Now, this is a big religious sect in Korea. They're a Christian church, but very fundamentalist, very secretive, and so they're not willing to report a lot. So this is a best guess by the CDC in South Korea. She refused to be tested in hospitals despite presenting symptoms and coming into close contact with more than 1,000 churchgoers at several tightly packed services. So you can imagine how this spread amongst the people there and then went out into the public in Korea. On February 23rd, South Korean President Moon Jae-in warned that the country faced a grave turning point in efforts to contain the outbreak. So South Korea implemented widespread testing as a response measure, and the country soon began conducting as many as 10,000 tests per day and built drive-through testing centers that can detect coronavirus cases in just 10 minutes. And right now, that's one of the criticisms of the Trump administration in the United States, is that South Korea was able to do this very quickly. Why aren't we? And whether that's a valid concern or not, based on the whole logistics of what South Korea faced, what their governmental powers were compared to the United States, is something we can discuss next week when we get into the political, governmental, legal concerns of the government's reaction to this. So officials said the clinics reduced testing time by a third, and South Korea had tested nearly 250,000 people for the new coronavirus and confirmed many of those. On February 14th, a Chinese tourist who tested positive for the virus died in France and became Europe's first fatality of the outbreak. By February 19th, an outbreak of the novel coronavirus began in Iran. And with about 18,400 confirmed coronavirus cases, Iran is currently the 4th most affected country in the world outside mainland China, Italy, and as of today, unfortunately, the United States. So all of the country's schools and universities closed down February 23rd, along with many movie theaters and cultural centers in Iran. Neighboring countries like Turkey and Pakistan also closed their borders with Iran. Iraq has also put an entry ban on any incoming Iranians into the country. The country released 54,000 prisoners to prevent outbreaks in its prisons, very tightly packed population centers. So according to Reuters, 23 members of Iran's parliament, or about 8% of the parliament, developed the coronavirus. One member, Fatima Rabar, a conservative lawmaker from Tehran, has actually died from the coronavirus. About 1,300 people in Iran have died from the virus. And Iran is certainly not alone in foreign leaders who've contracted the virus. Excuse me. In the United States, we've had a couple members of Congress test positive for it. Most probably out front, the one you've heard about, Rand Paul, the senator from Kentucky, has tested positive for it. Justin Trudeau, the Prime Minister of Canada, his wife has tested positive for it. And today we got the news that the Prime Minister of the United Kingdom, Boris Johnson, has now tested positive for the coronavirus. But what's different is in these other countries that I mentioned, the press is free to report on these things. Iran, a little bit different. The Iranian government has been accused of covering up the scale of the coronavirus and censoring the media's reporting on the outbreak in that country. It also threatened the death penalty to those who hoard unnecessarily materials or equipment, which is certainly a lot different than what we've done here. I don't know how much toilet paper would still be on the shelves if we promised the death penalty if you bought too much. By February 21st, the number of COVID-19 cases spiked in Italy, signaling an outbreak in the country was beginning. The country's coronavirus caseload has skyrocketed since that time. More than 41,000 people have been infected and more than 3,400 have died. It has become the most affected nation by the coronavirus aside from China and now the United States. By February 29th, the U.S. confirmed its first death from COVID-19 on American soil. The U.S.'s first publicly confirmed death related to the coronavirus was a man in his 50s who had underlying health issues. He died at Evergreen Health, a hospital in King County, Washington, very near Seattle. The U.S. has reported more than 13,000 coronavirus cases all across 50 states and Washington, D.C., and states it's also spread to Guam, Puerto Rico, the U.S. Virgin Islands, and other territories. So there's really nowhere in the United States that has not been touched by the coronavirus yet. More than 1,554 people as of this morning in the U.S. have died from the coronavirus, with Washington State leading the death toll. Matter of fact, 19 of the first 26 deaths, I recall, were from the same nursing home in Washington. So due to its population, though, density and cosmopolitan makeup, New York is soon expected to be the epicenter of cases and deaths. And if you follow the news, it's quickly coming to that. Between February 29th and March 19th, nearly all U.S. states have declared a state of emergency. And the reason they have to do this is for legal reasons that we'll get into next week, because governors declaring a state of emergency triggers certain laws that are already on the books and in effect for just these situations. So the strategic announcements can help states activate emergency response plans and spend more money on preparedness actions. And such declarations also authorize leaders to use funds to deploy additional personnel, buy equipment, and prepare stockpiles. By March 9th, Italy has placed all 60 million of its residents on lockdown. Italy was initially the hardest hit nation by the coronavirus outside of China. Like I said, as of today, the United States has now surpassed them in the number of reported cases. The country, Italy, initially saw two regions near Milan and Venice in the north become hot spots for the spread of the disease, down almost a dozen towns in them on February 23rd, affecting an estimated 50,000 people. The country's leadership in Italy has shut down schools, museums, public venues. They've discouraged public gatherings. And on March 9th, the government expanded the coronavirus restriction zone to encompass the entire country. Stores closed, all stores closed save for grocery markets and pharmacies. On March 11th, the WHO declared the outbreak a pandemic. The Greek word meaning all. That means it's not an epidemic. Epidemic is very localized. Epi means center. This is a pandemic. It is spread out over 6 of the 7 continents, Antarctica being the lone holdout. So the WHO made the decision based on the geographic spread of the disease, the severity of illnesses it causes, and its effects on society. The Director General of the WHO said, "Pandemic is not a word to use lightly or carelessly." He told reporters at a press briefing announcing the determination in Geneva on March 11th. Also on March 11th, President Trump banned all travel from 26 European countries, and it went into effect on that night. The UK and Ireland were later added, so that brought it up to 28 countries. However, the ban does not stop US citizens and some other groups from entering the country from Europe. The ban has caused crowds and long wait times at airports across the country, where people flying in from Europe, landing at O'Hare, oftentimes had 48 hours in line before they were adequately tested and cleared to go home. By March 13th, a US national emergency was declared over the novel coronavirus outbreak, and that's when our states, Illinois, started letting people go from schools and everything like that. So the declaration made by President Trump triggered the Stafford Act, again, one of those pre-existing laws that are in place for this type of thing. And what the Stafford Act allowed for was for more federal money to be sent to cities and municipalities. And Trump said that his decision would open up access to $50 billion in aid money for these US states and territories. Meanwhile, multiple news outlets reported that Congress was working on a roughly $1 trillion stimulus package to boost the economy amid the pandemic, and that has since increased to about $2 trillion, and that was the plan that was passed by the House of Representatives and signed by the president this morning. The president actually signed it this afternoon. So stimulus checks will be going out very soon to select groups of people. I think it's going to cover about 80% of the people in the United States should be getting a check worth roughly about $1,200 per adult and $500 each child, roughly. That's based on how much you earned, what your adjusted gross income on your income tax, your last income tax return filed was, and things like that. And the hopes of that, and we'll get into this when we talk about the economics of this as part of that disciplinary social science examination, is to stimulate the economy, and so that businesses are still promoting it. And of course, what's ironic about this is Trump is a Republican. The Democrats were totally against this, but this is a totally Keynesian policy, which we'll get into. By March 17th, Italy reported 475 COVID-19 deaths, the highest single-day death toll for any country since the pandemic began. And the Italian government launched an all-out battle against its coronavirus outbreak. The entire country, over 60 million people, was put on lockdown. By March 17th, again, a leaked federal plan warns the new coronavirus pandemic will last 18 months or longer and will come in multiple waves of infections, which is an interesting comparison to what we saw in the history of the Spanish flu. The New York Times reported it had seen a 100-page federal plan marked for official use only, not for public distribution or release, to tackle the ongoing pandemic. And the plan's forecast was pretty dire. The plan reportedly said product shortages could exacerbate the situation, impacting healthcare, emergency services, other elements of critical infrastructure. And I think if you watch the news, that is the big news items. Doctors, hospitals saying we're running out of necessary items. I know all over Facebook, just my friends, they're all talking about, oh, I'm at home sewing up masks. And we kind of talked about the value of those masks yesterday, whether that they had any value or not. But certainly these are the things that they're worried about. I know as a veteran, I got an email from the DoD, the Department of Defense, asking veterans with certain medical qualifications to come back into service voluntarily. I know Governor Pritzker has put out a message to retired doctors and nurses to please come back into the field to fill these slots. It also allegedly said there may be potentially critical shortages of staffing. We already discussed diagnostic capabilities and medical supplies, including PPE or personal protective equipment and pharmaceuticals, until an effective vaccine is developed. By March 20th to March 21st, for 2 days in a row, Italy reported the highest single daily COVID-19 death tolls for any country since the outbreak began. On March 20th, it was 627 dead. On March 21st, it was 793. Italian newspaper sources that I've read has said that the capacity to take care of the dead in morgues funeral homes has been exceeded, and they literally have trucks picking up bodies off the street basically to take them to be burned. By March 23rd, New York City became the epicenter of the coronavirus epidemic in the US, confirming many more cases. New York Governor Andrew Cuomo said on March 21st that following a dramatic increase in processing tests, the state was reckoning with a significant rise in the number of coronavirus cases, and that many of them were identified in residents younger than 60. Now, this is where I know this all sounds doom and gloom, but again, this is what's happening today. It's coming from media sources. First thing you got, media sources. Good news doesn't sell, and so many of the media sources are only going to give you the really bad news. The second thing you have to know is, even though it is bad news, a lot of this is projection, and we'll get into some of these projections too. And that a lot of this is, a lot of people may already be infected and just don't know it because of the testing. Once the testing improves, you're going to see skyrocketing numbers of cases of COVID-19, because now we know the people who are walking around today who might have it, they actually do have it, and they'll be recorded as numbers. So take that for what it's worth statistically. So by March 26th, the US leads the world with 82,404 confirmed cases, surpassing China's 81,782 and Italy's numbers. Of course, with China being a closed communist society, there's some concern that maybe they aren't reporting it fully either. So whether we've truly surpassed them or not, but based on the reported numbers, the United States has surpassed them. Data from the WHO also showed the same week that COVID-19's fatality rate had doubled since January. As of today, nearly 1 in 2 Americans have come under some form of lockdown as a result of state, county, and municipal actions. California Governor Gavin Newsom issued the first statewide stay-at-home order on March 19th, and other states followed suit. As coronavirus cases grew within the borders of several states, governors took the unprecedented steps of issuing stay-at-home orders. Stay-at-home orders, I'm sure you're aware by now, mean that residents should avoid going outside except for essential services, going to buy food or medicine, basically, and if they work in critical sectors related to food, medical care, or you might even heard your mechanic is considered essential because someone's got to take care of the vehicle so you can get to food and medical care. As of March 27th, the 22 states with stay-at-home orders were California, Colorado, Connecticut, Hawaii, Idaho, Illinois, Indiana, Louisiana, Massachusetts, Michigan, Minnesota, New Hampshire, New Jersey, New Mexico, New York, Ohio, Oregon, Vermont, Washington, West Virginia, and Wyoming. Specific cities and counties such as Philadelphia in Pennsylvania, St. Louis in Missouri, Anchorage in Alaska had also issued similar orders. And together, this put nearly half of Americans under some kind of sheltering order. The other half are not. Globally, authorities report that more than 558,502 confirmed cases of COVID-19, with about half of them active and ongoing cases, roughly 128,000 recoveries, and 25,251 deaths. When compared to 558,502 total confirmed cases, kind of puts it a little bit in perspective. More than 1,200 deaths in the United States have now been linked to the coronavirus, meaning that they were either the direct cause or they were a contributing cause, that the person already had some underlying health factors that may have been the main cause of their death. And they figure that as thousands of new cases are reported, the figure's growing as thousands of new cases are reported each day. As of today, this afternoon, at least 99,706 people across every state, plus Washington, D.C., and 3 U.S. territories have tested positive for the virus, according to a New York Times database. And at least 1,554 patients with the virus have died. The death tolls especially been severe in a handful of states, including New York, New Jersey, Washington, Louisiana, and California. But all across the country, case numbers are rising quickly as containment efforts falter and testing begins to ramp up. Like I said, New York State, which has been especially aggressive in testing, announced thousands of new cases on Friday. And that state accounts for about half the country's known coronavirus cases as a result. Again, it's been out there since November, being spread from China. There's a good chance a lot of people in the United States have it. They just haven't been tested for it. And so as the tests roll out, more of them are available, more people get tested. Don't be afraid or shocked as the numbers of recorded cases skyrocket. The odds are those reported cases skyrocketing, they already have it. It's not something new that all of a sudden is being spread like wildfire. That's already happened, basically. So the outbreak in the United States looks vastly different than it did a month ago. At the start of March, with extremely limited testing available, only 70 cases had been reported, and most of them were tied to overseas travel. And as the number of known cases reached into the hundreds, then the thousands of thousands, life across the country has changed in swift, profound ways. School playgrounds and college quads now stand deserted. Nail salons, department stores, and barber shops have been forced to close. Baseball spring training, college basketball tournaments, and concert tours have been called off. Some states have told people arriving from elsewhere to quarantine themselves. And though many of the first coronavirus cases in the United States were tied to overseas travel, outbreaks have become increasingly common. New clusters in nursing homes and other places, including an aircraft carrier, a church in Arkansas, are emerging each day. Public health officials often are unable to identify how people are becoming ill from it because they can't trace who they've been in contact with because they don't know everybody who has contracted it. So at the county jail in Chicago, at least 34 cases involving inmates and staff have been disclosed. In South Dakota, several inmates escaped from a women's prison after someone there was detected positive for the virus. In the federal system, at least 18 inmates and prison workers across the country have tested positive for the virus, including 5 in New York and 4 in Louisiana. A team of infectious disease experts calculates that the fatality rate in people who have symptoms of the disease caused by the new coronavirus is about 1.4%. Now, if that statistic holds true and you look at the number of people who've already died and you compare that to the population of the United States, it is kind of a statistic that suggests maybe we're already getting to that critical point and that things are going to go down. But these are all based on mathematical models, so I don't want to give you a false hope either. This is what the experts, the virologists, are predicting right now. So although that estimate applied specifically to Wuhan, China, the Chinese city where the outbreak began, and it's based on data from there, it does offer a guide to the rest of the world where many countries might see even lower death rates. The new figure is significantly below earlier estimates of 2% or 3%, and well below the death rate for others. And all how they got it was they simply just divided deaths by cases, which yields almost 4%. So while it is still higher than the average 0.1% death rate from seasonal flu, it raises hopes that the consequence of the coronavirus, this consequence, will be uncommon death. Now, cutting against that optimism is the expectation that because no one was immune to the new virus at first, that a majority of the population is going to be infected. And absent the quick arrival of a vaccine or drastic public health measures that close public places and cancel public events like we're trying to do. So the expectation that a majority of a population will become infected reflects a worst case scenario and depends on who encounters whom, something modelers called homogeneous mixing. But even the more realistic assumption that not everyone mixes with everyone else means that a quarter to a half of the population will very likely become infected, and matter of fact, might already be infected. Absent social distancing and vaccine, concludes Joseph Wu and Kathy Leung of the University of Hong Kong, who are leaders in the modeling of infectious diseases, and their colleagues. The better news, like I said, involves the fatality rates. And to calculate those, the researchers used data from Wuhan, especially the age distribution of 425 early cases and 41 early fatalities there. The chance of someone with symptomatic COVID-19 dying varied by age, confirming other studies. For those aged 15 to 44, the fatality rate is 0.5%, though it may have been as low or as high as 1.3%. For people 45 to 64, the fatality rate was also 0.5%, with a possible low of 2.2% and a possible high of 1.1%. For those over 64, it was 2.7%, with a low and high estimate of 1.5% and 4.7%. And the chance of serious illness from coronavirus infection in younger people was so low that they estimate a statistical fatality rate of 0. So as physicians and researchers have seen since the start of the outbreak, a lot of infected people have become sick, but there is a distinct difference between infection and illness. A lot of people can be infected, but not a lot of people are going to get sick from it. As few as 14% of people in Wuhan with early coronavirus infections were being detected, said epidemiologist Jeffrey Shaman of the Mailman School of Public Health at Columbia University, who led a study published on Monday in Science on undocumented coronavirus infections. I think there are more than nearly 70,000 confirmed COVID-19 cases in the United States, he told reporters, and that means the infection fatality rate, deaths among people from the virus who might or might not show disease symptoms is even lower than Wu and Lung would calculate, which in a way is kind of good news, and it kind of leads the question, is the cure worse than the disease? And that's a question we'll consider as we go on too, and we talk about next week government actions for this, what are the legalities, what exactly can the government force us to do constitutionally, particularly in the United States, and is it the right thing to do? And those are things we'll certainly consider. So that was the whole slideshow. I'm going to open it up to you guys right now if you have any questions or anything you want to add. So we will meet again on Monday, and I'm hoping at that time to have some kind of video or something to show the pretty much about the same timeline we talked about, but to give you a visual explanation of it. And then we'll spend the rest of the week kind of talking about, you know, what is the constitutionality? We'll get into the political science of all this, the politics, the legalities, the constitutionality of all these effects that we have from the government. So if you guys don't have any questions,
Nope.
enjoy your weekend, and I'll see you later.
You too.